When we talk choice, there's not much more important than health care. The president sold Obamacare saying it would lower costs and yet give us more coverage and more good choices. Win-win. Some people would gain better insurance, and even if you didn't, you wouldn't lose anything.
If you like your doctor, you will be able to keep your doctor, period.
Oops, that one didn't work out so well. Millions have learned that, no, you don't get to keep your doctor. 6 million policies were canceled, but millions of Americans who did not have health insurance before now do have it. And that's why Obamacare is good, says Dr. Kathleen London of Doctors for America, a group that wants government to pay for more of our health care. On the other side, Michael Tanner of the Cato Institute, who wrote a book saying we need more competition and less government. So, Kathleen, I agree with Michael, but you say Obamacare is a great thing.
I'm looking at the number of people who have come in who before had to choose between paying their rent or paying for health care, or who couldn't get it because of pre-existing conditions or other reasons, who are now able to actually get coverage. Those plans that were canceled weren't really good coverage. These were plans that when you got really sick, they were going to be gone.
Greedy insurance companies were selling junk to people.
Well, actually, we know that the number one reason, for example, that plans didn't meet the Obamacare standards was they didn't offer sufficiently lengthy time of a maternity recovery. Well, okay, that's fine, but if I'm a 55-year-old gay man, I'm probably not worried about my maternity coverage.
But we're all in this together. Don't we want everybody covered?
Sure, and let's give credit where it's due. Obamacare has covered about 8 million people, although about half of those have been pushed into Medicaid, which really isn't very good insurance. Still, in exchange for that, roughly 5 million people lost their health insurance, were forced to get other types of policies. I can't buy the type of insurance that I want today, and in many cases I'm being pushed into an insurance plan that has a very narrow network and may not include my current doctor.
And I wouldn't even agree with you to say we want everybody covered. I want a free market. I want people to have skin in the game.
We did that. It failed.
When?
That's what we had before.
No,
before
it's not.
the ACA, we had a free market.
No, we didn't.
How did we not have a free market before?
90% of the bills were paid by somebody else, either government, 60%, or a private insurance company. So if I went to see you, I'm not saying, hey, doc, do I really need this test? What'll it cost? If I gave you the money, you wouldn't even have a cash box to take it. You're getting money from insurance companies.
Go back 20, 30
years.
years.
That's not a market.
Go back 20, 30 years, we had that. Go back 40 years,
We haven't
50
had
years.
it since World War II.
Well, that started because of trying to give another way of incentive to hire employees. So that started all because of
big government
that.
managing our lives, reducing our choices. And now we have more of it with Obamacare.
Insurance companies are more of the issue that you're discussing and the frustrations you're discussing. And I don't disagree on that mark of it. Honestly, as a physician, I have more difficulty dealing with private insurers than I do Medicare.
But that's not going to be the case for long. And beginning in 2017, when the Independent Payment Advisory Board takes effect, the government is going to begin to ratchet down reimbursement rates to physicians. That's bound to lead to rationing. If you increase demand, decrease supply, you don't have to be an economic genius to recognize what's going to happen.
Somebody's going to ration. Either it's the patient, if you pay yourself, or it's a private insurance company, or it's the government.
But it should be me. I should ultimately make that decision.
Well,
not
then pay your own
party.
bills.
I should, but unfortunately under Obamacare I can't, because I'm mandated to buy insurance and mandated to buy a specific type of insurance that the government thinks I should have, that has the benefits they think I should have.
Kathleen, why do I have to buy alcohol rehab coverage and diet care and maternity care?
That all kind of goes together. Yes, that we are a society and this goes into
why don't I have
pool.
choice to get what I want?
Because at the end of the day, your dietary choices is stuff we are all paying for. We are paying for that. We have an obesity epidemic, that diabetes is now the number one thing that we are now having as an epidemic in this country and that we're all paying for. That we do have alcoholism as an issue. That we do have all these problems. So you pay now or you pay later. It's a whole lot cheaper to pay it now. As for the maternity care, when we didn't have that mandate, when I was in medical school, I got pregnant right as I was graduating and started residency. There I am with my MD from Yale, starting residency in Oregon. Guess what? It was a pre-existing condition. I couldn't get coverage. A physician starting residency.
So if you could afford the tuition at Yale, you could pay your maternity bill.
I was being paid $20,000 a year as a resident, and I couldn't get maternity care.
Look, there are ways to deal with pre-existing conditions that don't involve simply overcharging young, healthy people and making them subsidize older and sicker people. Why should someone who's just got out of college, who's got a $20,000 a year job in residency, be subsidizing insurance for Warren Buffett and Bill Gates? Essentially, that's what Obamacare does. It makes young, healthy people subsidize older and sicker people.
The one area of medicine where insurance doesn't pay, LASIK eye surgery, prices came down. And there's competition. The doctors give out their cell phone numbers because they want to please the patients. And
the same is true with cosmetic surgery and even dental care, which is less covered. Prices have not risen anywhere near at the rate that insurance-covered services have risen.
So you want to take the risk that when you need bypass surgery, you're paying that out of pocket?
That's
or you
catastrophic.
end up being hit by a car?
I want to buy a catastrophic policy that covers me being hit by a car or bypass surgery. But the small stuff, I want to pay myself. I want to market.
So what are you going to do about all the lifestyle issues? What are you going to do about all the inherited diseases and everything else? So again, you get back to the idea that we are a society.
Shouldn't people be responsible for their own lifestyle issues? Look, if I go out and eat 20 Big Macs tomorrow and have a heart attack, isn't that my responsibility?
And so what about, so you're going to ding people for having bad genetics?
I'm going to ding people for
someone
having bad habits and bad lifestyles.
And what about their genetics? So that they're born with missing a gene that ends up being an incredibly expensive therapy? That's their fault? Really?
Now, look, we can deal with people with pre-existing conditions. Virtually every proposal to replace Obamacare includes some provision to cover people with pre-existing conditions through things like risk pools and things like that we deal with people with high-risk drivers.
But no one dealt with it until Obamacare happened. I'm not saying it's a perfect plan, but it was the one that we could get through that Congress. It was the first one that addressed pre-existing conditions, rescission of care, of lifetime caps, and everything else, and all the issues that we do have that weren't being addressed. And as we move forward, we will continue to form it into something that is going to be better.
Since we're all in this together, you say, and others have to pay for my costs, should we ban cigarettes, ban alcohol?
I do believe in sin tax.
Should we require mandatory calisthenics every morning? They do that in North Korea. They all show up in their little green jumpsuits.
Okay,
and so
on that note.